So for those who don't know me, my name is Steve Canham. I work for ECRIN, and along with several of my colleagues from ECRIN, we've been responsible for putting together the draft strategic agenda. And this is a presentation of that agenda. I should apologise to those who were here yesterday because it's very similar to the presentation of the draft strategic agenda that I did yesterday as part of the AGM. So sorry. There are some differences, but not huge ones. So the plan of the session is to give some background and context, to talk about how we eventually reach some sort of consensus, the ideas for services that have been developed, go through those, some summary thoughts about where the agenda is and the HRIC is, and then some voting. Using a Mentimeter, we'd like to get some feedback from you and the people online about the views on the various services that have been suggested within HRIC. Okay. Genesis of the HealthyCloud project and HRIC comes back to the meeting that Christina mentioned and described earlier this morning, this 2018 seminal workshop that was held to discuss the possibilities and the objectives of a European Health Research and Innovation Cloud. One of the authors, Nicholas Blomberg, was here. He's disappeared, but he was here. So this was a key meeting with a very large number of people involved, and it talked about the creation of a Health Research and Innovation Cloud. It's worth pointing out at this time that although EOSC was in preparation phase, EHDS2 had not been discussed or even mentioned. So this was very much, these proposals were very much put as something building on EOSC. In fact, it explicitly says so. They came up with 5 recommendations, which again, Christina did list as well, but it's worth just having a quick look through them. Provide and foster standards, good practices and guidelines, certify infrastructures and services for a HRIC, an ethical and legal framework for a HRIC, establish a proper environment for training and fund public and private initiatives. Rather vague, necessarily so at this point, because it's just an initial attempt, but they're actually not, different from the suggestions we currently got. The suggestions we currently got are in many ways built upon these early recommendations, as it happens, not deliberately, but they've turned out that way. That meeting led in turn to this 30 months CSA project, the HealthyCloud project. As Salva and Juan said, it's the E in the middle is the Spanish bit, but the 8 work packages, of which number 1 is coordination, the rest are listed there, and then WP8. The aim is to produce a strategic agenda to advance the establishment of the European Health Research and Innovation Cloud. So that's where we come from, essentially. This is an overview of where we've been. We're at the red arrow. So we've gone through various discussions. We've produced a discussion paper. We've done some work on trying to build a consensus. We've now produced a draft strategic agenda, which hopefully some of you have been able to read. And the next stage is the stakeholder workshops, where this needs to be discussed further. This I put on because I like this graphic, basically, which took me hours to do, it must be said. But it's to stress the heterogeneity of the context that the HRIC has to work within. Huge mix of data types, data sources, data users, different terminologies, different ways of organizing data, different jurisdictions, regulations, languages, and all sorts of challenges. So it's a big, and as people have said all morning really, it's a large and complex area. To try and make sense of that and to, if you like, clarify the scope of the HRIC. We went through a 4-month process of creating a discussion paper to identify the issues that a HRIC should be addressing, in a sense to define the scope of the whole idea, the whole project. That resulted in these 6 main areas being identified. So, as I said, I'm sorry I was repeating from yesterday, but 2 key areas: legal uncertainties, which we've heard a bit more about this morning, and ethics and trust. And they are separate here because they were deemed to be important enough to be separate rather than a combined LC lump. 2 key areas around fair data, discovery metadata on the one hand, and interoperability on the other. Again, things which have been mentioned a lot this morning. And then technical infrastructures, key component, development of secure processing environments, etc. And then this underlying problem of sustainability. If you can, you know, and in particular, how such services or such whatever is developed can be developed on a at least semi-permanent basis rather than being a succession of short-term projects. Because this is one of the problems with all infrastructure programs within Europe at the moment. You can develop a system, and at the end of 3 years, you've then got to find a home for it, or it just disappears again. There was a all-hands meeting in February to discuss the findings of the discussion paper. 2 further areas were identified. One was how do you incentivize data sharing, and the other one was access governance. So that's where we were in the early part of this year. Some of this is, I'm going to whiz through this because it's been covered. But the problem, if you like, or the characteristic of this debate has been that, of course, the HRIC isn't operating in isolation. There is a lot of other stuff going on. And amongst the things going on is EOSC, which we've heard about earlier. And I'm sure most people are very familiar with EOSC, but essentially it's there to promote and support open science across all the domains in Europe. If you go, and I mean, lots of people are involved with EOSC-related projects. If you go to the EOSC portal, you can see that medical and health sciences are part of the scope of EOSC. There's no argument about that. If you click on that, medical and health sciences, you get a list of the currently available open science data resources. There's actually 28 listed. Well, there was 2 days ago, which is probably, I mean, I have to say, it's probably less than you'd expect, but this is in relatively early stages of the EOSC rollout. And it may be that this is a function of the difficulty of making sensitive data, you know, easily available. Not necessarily publicly available, but available. So there's EOSC. There is also, of course, as Jerome was saying, EHDS. And so you've got these 2 pillars of EHDS, which has come in more recently, but the one dealing with primary use, the support of not just free movement, but safe movement of people across borders by allowing primary reuse of health data for primary purposes, for treatment. But also Health Data EU, which is the secondary reuse pillar, and that is about the development of a whole ecosystem. It's the same diagram as Jerome was using, of structures, health data access bodies, SPEs, i.e. secure processing environments, various central services, infrastructures, you know, whatever's required for safe and legally compliant management of reuse of data, health data. So that's, and that obviously has huge implications as a resource of all sorts of types for health-related research going forward. So there's these 2 major infrastructure developments. And the issue has always been, throughout the debates we've had in WP8, where does the HRIC fit? As both EOSC and EHDS continue their development, where does HRIC fit in? Is there room for HRIC to slide through the gap, or is that a realistic proposition at all? To add to the fun, we have these little explosions of new regulations and laws coming up every year or so. So there's the Data Governance Act, there's the Artificial Intelligence Act. There is nothing intelligent about artificial intelligence. It's one of the most poorly named things ever. The strategy for data. So there's a continuous sort of set of explosions of policies and regulations and laws coming through. Difficult. And this is just at the European level, the European plane. You could add to that a whole variety of, in another dimension if you like, a whole variety of national initiatives that are coming through, just to make life more interesting. Obviously they are linked to EHDS in particular, but they are coming through at different times with slightly different backgrounds, and it complicates the landscape enormously. You've also got global developments in standards, for instance. You've also got large numbers of projects being funded by Horizon Europe and others around. So this is a really complex, busy area. And it's partly because of that, actually, partly because of so much development, I think, that people are interested in the idea of a HRIC. A recurring debate, a recurring theme, has been, where would a HRIC stand in relation to EOSC and EHDS2? We're not sure where EOSC and EHDS2 stand in relation to each other, but which is another complicating factor. But initially, as I said, the HRIC was really envisaged as EOSC Health in many ways, as a sub-part of EOSC specialising in health. That was the original conception. But you could, and some people have, I've heard it said, that you could equally see HRIC as EHDS research, and stick it the other way around. You could put it somewhere, use a HRIC as an interface between the two in some way. Yeah, one of the things that's come up this morning, I think, is this question about what is the interface going to be between EOSC and EHDS. Well, perhaps one way of constructing that interface, amongst other things, would be to produce some a HRIC in the middle, facing both ways, Janus-like in the middle. Or it could be completely independent, somehow a separate body. Or it could be none of those, or a mixture of all of them. I mean, the structural parts of HRIC have not yet been clarified. We tried, this is just us, enjoying ourselves in Paris, having a workshop to try and clarify some of these sort of major issues, orientation issues, developing a consensus. And the consensus that we ended up with, I think it's reasonably fair to say, was that at the end of the day, we weren't that bothered about which part of EOSC or EHDS a HRIC would fit in. We were much more bothered about identifying the problems people had, the gaps and uncertainties they had, the concerns they had, sometimes concerns that things still weren't being tackled, even despite this sort of raft of large numbers of different initiatives and movements going on. Sometimes the gaps and concerns were because too many initiatives were happening and people were concerned about how they would interact and what the final shape of these things would be and what they would then have to deal with. So some of the needs there listed for better coordination, for specific support for sensitive data management, better guidance, provision of SBEs, good links to RIs, adequate training. These are all things that they came up in the original workshop to some extent, and they've come up again here. What the conclusion was, if we could identify the needs and gaps, acknowledging that there was ongoing work on most of them, people are aware of various initiatives tackling these things, but nevertheless they were perceived as remaining problems. Then if we could identify those gaps, then we could go on to specify the services that a HRIC could provide. And those 10 services are what's in the strategic agenda document as being the things a HRIC could provide. They don't form a coherent group in the sense that one doesn't feed into two, three doesn't feed into four. They're quite a disparate group actually, but they could all have a HRIC label attached to them if that was felt to be a good idea. So those are the 10 services. I'll go through them in a bit more detail in a minute, but before that, any comments or questions about what I've said so far? Or are you stunned? Is that okay? All right, I'll carry on. I'm going to go through all 10. They fall into 5 more or less linked pairs. So I'll go through each of the 5 pairs. Now, at the end of the session, or towards the end of the session, we want to ask you to vote on these services. We want some feedback, and particularly for those, whoever's out there, and external people coming in. So we've set up a Mentimeter exercise at the end, and what we're going to ask you to do is to tick, if you like, or mark the 3 services that you think are the most important out of these 10. So and that's all. Nothing more complicated than that. So at the end, we will ask you to, we'll put up a list on the Mentimeter website and ask you to tick the 3 you think are important. And hopefully, we'll get the feedback on that fairly quickly, and we can feed it into the discussion as well. So pay attention, because you'll need to choose your 3 as we go through. So as I said, 5 more or less linked pairs of services have been proposed. The first 2 fall broadly into this monitoring and advocacy idea services. The first one is probably the simplest and cheapest of all of them, and the idea basically will be to rerun WP8 at periodic intervals. In other words, what we're saying is it would be a good idea to every so often, every 3 years, or every time there's a World Cup or something, people would have a look around and discuss again what were their concerns, gaps that they saw, uncertainties and problems that they saw in health-related research, put that together into some sort of report using some sort of methodology, and push it back to the other people involved, in particular the Commission as funders, but also EOSC and other infrastructures. So in other words, keep people informed. It's an advocacy function in the sense that it's taking in people's opinions and trying to push them to those with the money. So that's one idea, one service. You could, we were discussing earlier, you could make that a periodic project, but it might make more sense to make it a persistent infrastructure. The second one there, 3.6 it is in the document, is looking at a similar idea but with a narrower scope. So say within EOSC, although the same could apply within any organisation, it's really setting up a sort of special interest group looking after the interests and, again, concerns of health-related research, particularly with regards to sensitive data. So this is a specialist group within EOSC in many ways. And lobbying for the inclusion of specific services where that was felt to be useful, feeding back to the EOSC structure in this case about problems or successes as well. I mean, it's a dialogue mechanism essentially. So those are the 2 simple services. The next 2, something that's come up repeatedly today, the need for guidance on legal and regulatory issues. I mean, within a country, it is, I think, becoming increasingly possible for people to work out what the rules are. Not always easy, but at least they stand a chance. Even then, it's not always clear to them or anyone else that they are actually legally compliant, because the legal framework is still developing, so vague, and hasn't yet been tested to a large extent in courts. So there is a need, and particularly for multinational research, when the picture becomes very complex very quickly, because GDPR, as we all know, has not made for a level playing field. And we're not sure about what EHDS will do yet. There's a need for some guidance. And that, to be useful, has to be authoritative. It means it's got to be with people like the EDPB, the Data Protection Board, and perhaps therefore it needs to be done at a high enough level involving the whole of the health-related research community rather than isolated bits of it. Related to that is the fourth service there, which is a training service. Obviously, there's lots of training going on, lots of training materials being developed. But as, again, I think Christina was saying, what can you do with small amounts of money left over at the end of a grant project? Often it's very, very limited. So is there a call, is there a useful addition by producing a service which can focus, concentrate, centralize resources, expertise, generally as a training resource on a whole variety of areas, not just legal regulatory issues, but how to use a secure processing environment, how to apply a metadata schema, all sorts of whatever's required as things develop, essentially. So that's the fourth service. 5 and 6, or 4 and 5 in the paper, looking at promotion of fair data. Again, there is existing work going on this. There's plenty of EOS projects now looking at metadata standards, for instance. But these are both large, complex areas. And to be honest, particularly when you get into semantic interoperability, you're looking at decades of work. Would this be better done as an infrastructure service rather than a series of small-scale projects, which often overlap, it must be said? In terms of efficiency of member states' money, would it be better for some of this effort to go into a HRIC service rather than a series of projects? It's the question. So 2 there, one focused on metadata and findability, particularly across domains, and the second on interoperability, which is not just about data wrangling and reorganizing data, it's about the semantics and the categories and the terminologies used, which is the really tricky bit. 2 more services. This is back to the base idea of the HRIC, back to the discussions in the workshop. The idea of resources connected with health-related research being specifically grouped and organized, which can be done at 2 levels. It can be done as a catalog service. In other words, it's about identifying resources that already exist, characterizing them, describing them, putting them into a portal so that people can access them, etc., etc. And helping those resources also become more standardized as time goes on. Or you can take, if you like, the gold option, the more expensive option, and start to produce specific resources which don't already exist. Perhaps because you want to develop new techniques, new ways of using encryption or natural language processing or something, and they don't exist. Or perhaps because there is a genuine gap in a particular type of data, and there's a need to pull that together in a new repository. That obviously is the more expensive and more complex option, but my guess is that's what was closest to the original conception. But EOS Health has got broader. Not EOS Health, HRIC has got broader since. The final 2. Both we've called these interface services. The first one is an interface with EHDS2 or Health Data EU, as we should call it, because the feeling, I think, is that there will be a need for an interface of some form. Exactly where it is, it remains unclear at the moment, but the research community needs to be able to talk to and make its views known to EHDS and vice versa. And it may be here that the existing RIs would be the obvious route, that between them they could form a structure which would act as the interface there. Finally, the last one is perhaps one of the most important, but also one of the most difficult, which is an interface from the research community to the public and press and politicians and everything else, non-scientists, if you like. Important because, of course, it doesn't take a lot for this whole idea and structure to come tumbling down if there are too many unfortunate incidents of data loss or misuse. And let's face it, there have been some big tech in particular are not to be trusted further than you can throw them, frankly. You know, Google and Facebook or whatever, Metaverse or whatever they are, have their own agendas. And it's about gathering in data for training their algorithms. It's not about preserving the privacy of individuals. It doesn't take a lot for people to say, whoa, enough, pull back, and the whole idea of data reuse could get seriously damaged if trust is not maintained, which means there is a need to try and develop ways of explaining what's going on and trying to keep what's happening transparent enough for people to have some trust in the operations that's happening. Not easy. It's easy to say, not easy to do, but it may be an important service. So those are the HRIC services. The key question is, who pays for it all? And the answer is, we have no idea, basically. No money has been allocated to any of these, or the HRIC as a whole. At the moment, we're just talking about what might happen, what might be useful. We've had a lot of talk, hence cloud. There are websites you can go to, you put in the text and it gives you a cloud back. It's quite fun. So, but basically, we don't know, and really we don't care. The gist of this is we are agnostic about who pays for it. It's whoever's willing to pay for it, to be honest. If EOSC have got some funds and they want to push a particular service, great. If EHDS think this belongs to them and they want to push that service, equally great. We don't care. If B1MG do, or whoever, it's the umbrella and the branding is not important, the service is. It's our general view. Right. Somebody's phone linked in, I think. So essentially that's where we are. You know, relatively agnostic about things. Now that may mean that HRIC itself as an entity doesn't exist. The services may exist, and they all may have a label which says this is a HRIC service, but they may not. It's more about getting these services into play. Where are we? I think WP8 has been a checkpoint, really, this whole exercise. It's been an opportunity to look around and to discuss the further development and support of health-related research. We've identified these gaps and uncertainties. They are reassuringly similar to the ones in the workshop, and we have identified these services and resources that would be useful to have, which again, reassuringly, are extensions and developments of the one in the original workshop. I think there's no doubt we have to be flexible about what we mean by a HRIC. The important thing is the services. So a HRIC might not appear at all, but let's get the services going. We need to broaden the discussion around what services and resources are required with more people, etc. But at the same time, if we're not going to just go around the same circles we've already been around, we need to keep it focused on the actual services and specifications that have been put forward, and produce more detailed descriptions of what might be possible or desirable, because the more detail is, the easier it is to cost them. And perhaps they should be prioritized as well. Who knows? I mentioned before, but in the next 4 months, there are 4 stakeholder workshops. The first one in just 3 weeks' time, I think, near enough. And so those are coming up. They will be obviously very important in trying to put some more flesh around these ideas, on these bones. And where next? So the original idea is for the HRIC agenda was to be an implementable roadmap for HRIC. Now, I don't think that's possible, because you can't implement anything if you don't have any money. You can't make any implementation decisions. So you either need some funds, or you need a robust business model, and we don't really have that either. I mean, essentially, Business models in this area are really difficult because users won't pay for services, generally speaking. Certainly the people that put the data in won't pay for services, which leaves you either with European infrastructures or national governments paying for them. If you don't get that, you don't get the services. So the business model is quite easy, really. So we do need some sort of model, I would suggest, for sustainability. Otherwise, you don't get an infrastructure project. You get a series of small, short-term projects, which, as I say, I don't think is the most efficient way of doing it. It may be useful to set boundaries a bit. I think one of the problems we've had over the last year is that we've had insufficient boundaries on the discussion. So we've not quite known what's possible and what's not. Now, I can understand the reluctance of the Commission and the DGs to tell people what the rules are, what the boundaries are. I think it would be useful if they could tell people what's not possible. I mean, if someone said, look, you're not going to get a HRIC, forget about it. We'll might be able to fund some of these services if you make the case strongly enough, but you're not going to get another infrastructure into what is already a crowded place for infrastructures. That would be a useful point to make, I think. It would clarify stuff, particularly for the stakeholders going forward. And any other boundaries that come to mind would be useful to set. Let's try and clarify what is possible, what's not. Something that's not happened up to now, it might be worth thinking about, is can commercial companies be involved in this in any way? You know, the IHI initiatives are large-scale, well-financed work. There's a lot of stuff going on there. Eden was mentioned earlier on, for instance. Do they have a role in a HRIC? I don't know what the answer is, but I think it's a good question. The final date for the strategic agenda is August, but that means, as we were saying yesterday, that in fact most of the work has to be done by June, which means that this group and the stakeholders and everybody else has got 6 months of really quite intensive work to clarify this and get it down into a substantial document that can be then sent to the Commission, essentially. And that's it from me. Before we get into voting, what's that? 38 minutes, that's not too bad. Before we get into voting, any general points or discussion? But we can have them after we do the vote, otherwise. Gary, yeah.
Yes, thanks, Steve. Gary Saunders, ECRIN. Maybe when you're talking about setting boundaries, I think it's really important to say that in the generation of the strategic agenda, we've had a lot of feedback. So some of these services might be in EOSC, some of them might be visioned to be in EHDS. But what I think is nice is that we've not really had much feedback to say that we need services outside of this 10. So if you think about setting boundaries, then these 10 services, I think, are somewhere that we're really starting to solidify around. And we don't have that much time left in the project. So I would encourage us, and I'll be leading a lot of these workshops for the stakeholder engagement. It will be about getting feedback on these 10 services rather than broadening out. So I think that's quite important. If you're trying to set boundaries, maybe we concentrate on these services that we have here.
I would agree 100%. Yeah. I mean, I think it may be that 3 of them might fall out, and people will say, well, we don't really need these at the moment. These not, and these. But what we don't want is 11 and 12 and 13 to start, considering those. Was it Mihaela at the back? Yeah.
So, Steve, regarding your question, how to focus the discussion better from a legal perspective, I mean, concerning the legal services, I think it's important to look at the models that we want to adopt, because the legal services depends to a great extent on the legal model, business model that we adopt. Yeah. So without that, we'll end up with the same discussions that we had in other projects, meaning what is the regulatory framework in that and that country? How can we do it in order to comply with the national legislation? So We have produced a lot of guidance, model agreements, etc., transfer agreements. So my concern is that if we do the same thing in the context of this project, we might not improve the situation. So can we set the boundaries in this respect, meaning to look at the model, not business model, but what kind of model we want to adopt in order to better focus the legal discussion?
So do you mean in terms of the services to be provided by?
Absolutely, yeah.
So we're not looking at a legal office that people can phone up and say, what do I do in this case?
Yeah.
It's more a set of resources that people can use.
Exactly.
Yeah.
And then maybe we should look at the connection between this and the European Health Data Space and take it from there.
Yeah. I think actually there's a broader issue, because if you're going to say to folks here, make use of these legal services, and have some sort of business model involved, that may be that in the original grants from the funders, there has to be some funds to make use of that. And extending that, there should be funds for people to de-identify data, for example, and to whatever additional work is required on consent forms, etc. Otherwise, people, I mean, it's happened to us working with people. People get to the end of a study. We say, can we have the data? They say, well, yeah, but we don't have any resources to de-identify it. We're not sure how we do it, where we go, where to put it. All sorts of issues come up. And these things really need to be put in at the beginning and properly funded. So it's not so much management of big data, it's the management of small data that needs to be sorted. Niklas.
So just looking at that list and reflecting on some of the talks this morning, I think we start to see quite a nice sort of interface with the various high-level initiatives. So one of the things I've taken away from the talks by the colleagues from the Commission is really, so I see a very strong high-level similarity between the genomics data infrastructure that we are driving in within Elixir and, in a way, the European health data space. So in the 1 million genomes or the genomics data infrastructure, I think the really significant part of that, apart from the technical work, is the sort of strong ministry level backing for making this personal data available for research purposes with the explicit aim of improving future health and care in Europe. And if you look at the European health data space, especially the second work pillar that Jeroen was talking about earlier, it is very much the same thing. It's a very strong sort of ministry level backing for making very sensitive data available for advanced medical research. If we look at your list here, I think I see a lot of items that I think fit very naturally into the EOSC structures that Maria Luisa was elaborating on earlier today. I mean, the metadata, data interoperability is really part of the core of EOSC, working with communities to codify that, training and people development and so on. I think that the space I see in the middle, which is really unfilled and I think is very critical, is to say that we get this data out of these national data resources and available for sort of advanced analytics, artificial intelligence, digital twins. That requires secure collaborative environments with actually quite a lot of compute and storage power on the level that is only provided by some significant national centers or the European HPC centers. There's not many places you can go and get, say, a couple of 100,000 cores of GPUs to run deep learning algorithms. And I think that's really where we can. It doesn't necessarily require a new organization, but it does require some concerted thinking and sort of collaboration across the communities to make that possible within the European sort of structure. But if we can get that working, so that there are ways of making data available for advanced research in these environments, I think we can really propel sort of European research. And that doesn't compete with federated learning approaches, but I think there will be things where the amount of compute power really exceeds what local centers can provide.
Yeah, I think that's true. I mean, I have a certain level of skepticism about the use of big data, because I suppose because at the end of the day, I think you still got to go down for, you know, the double-blind clinical trial, to randomized clinical trial to actually get the firm evidence of causation. I think there's a tendency to use, you know, mining and collation, perhaps to get too enthusiastic about what it's capable of, but it obviously has a contribution, and all these parts have different contributions to make. And you're right, the compute ability will be critical. But of course, then you also raise the issue of cross-national transfers of data, and all the complexities that brings. Can we ask you to vote? Oh, sorry, Christina.
Yes, thank you very much. I just want, something I'd say it's not so visionary, just one comment that I come back to the discussion of that genome paper and the workshop and the different examples that I gave from the COVID-19 infectious diseases community. There is an absolute need for the community that they are not working in their daily business with data scientists and clinicians or data sharing, but there are communities that they are start now to create. They are in the infancy of start creating, you know, sharing data, not in a large scale yet, but or smaller regions, researchers in smaller hospitals. So the idea of having kind of some guidelines for fair data or guidelines for or examples of how to do the legal and ethics guidelines. I mean, we have so many projects. That was the idea when we brought them together. If someone just goes and analyzes data and makes a map, like a pathway. If you are working with genomic data, this is the best practice. If you're working with public health data, this is some good practices. Fair guidelines. This was one idea of the HealthyCloud, to come with some tangible guidelines on that aspects. Well, and I was wondering if that could be a good focus for the next tangible focus for the next period of the project as a first reaction, and then I can say the view.
I think one of the working groups practices specifically looking
and then I can mention something. There also, the community needs a lot. There is a need for multidisciplinary research and basic and clinical research and IT and AI and data scientists and IT technologies. So there is a lot of training produced by projects, by European infrastructures, e-training, webinars. I mean, we could imagine like...
There needs to be the money.
No?
There needs to be... We were talking about this yesterday.
E-training.
There is a need for technical skills and training. There's a need for data management skills, but they have to be paid because we can't recruit those people.
And also the cloud idea, which was inspired by the OSC idea at that time, it is also open access. The resources that one can find in health research, where like a portal where you can find public information. Is not only to do a closed collaboration in a consortium, but it's also the other dimension of being available to a broad community of researchers and enable innovation with state-of-the-art approaches. So it's also the rest of the community and the open access, real open access.
But I say again, what I think the funders need to be aware of is that the expertise that's required to properly, at a technical level and at a sort of data management level, costs money that simply isn't there in the system at the moment. But we can't recruit staff to do a lot of these projects.
No, but I thought we have a lot of European thematic projects that they are doing that with the European infrastructures, with other infrastructures, innovative medicines initiative. We have some outcomes, deliverables that could create. One could create a synthesis and create a consensus guidelines that the funders could use and other new projects could use.
Okay, thanks.
Thank you.
Thank you. Can we have a vote?
Thank you.
And then can we carry on debating, discussing afterwards?
Okay.
We need to get the data in if we can. So, jolly good. Vote away, please. What's the percentage? Yeah. So people have been voting, yeah? Good. Not yet. Please vote. Your big chance. Thank you, whoever said that. I was yes. The absolute numbers must be quite small because they're changing quite quickly. Oop. 29, yeah. $31, going up. Any more for any more? We're stuck on 31 at the moment. Do I hear any more in the room? You're only allowed 3, by the way. No cheating. Anyone who does more than 3, we will find out who you are. And we will kill you. But apart from that, yes. 32. Any more for any more? Cheers, Nicholas. A few more minutes. Anyone still voting in the room? Dun, dun, dun. Whoop, 33. 34. This, I think, is already looking very, very interesting. Perhaps you could do this at the end of each stakeholder meeting and have a similar exercise. Collect more votes. Yes. The interesting differences between the meetings. Yeah. Yes, I was waiting. Well, I got 35. I don't think there's any more. So, okay. Not in any particular order, because I think this is the most interesting thing for me, is that the lowest at 4% is 8, which is an EOS Health Service resource. So that was, I think, the closest to the original conception of HRIC. I would say that's what people meant. And next to it is the Health Catalogue Service. They're 4 and 5%. I know it's a small sample, but 4 and 5%, the smallest, which is really quite interesting. The highest, 17%, is a data interoperability service. And I think that says a large amount about what people are actually worried about or spending money on time and effort. And then 13% is the metadata standard service. So going through them, we got the monitoring service, this idea of a periodic WP8, if you like, is 11%. A legal regulatory guidance service, 15, so that's the second highest. Again, where people's concerns are. Training service, 11%, pretty reasonable. Metadata standards, as I say, 13. 18% is the highest. Data interoperability service. Then an EOS sensitive data user service, not for sensitive users, but for sensitive data, at 6. And this is also 6, but it's at a different height. So presumably 5 and a bit. Is the EOS Health Catalogue Service, and then the lowest one, Health Resource Service, which is fascinating. 13% is the community service interface, between the research community and EHDS, Health Data EU. There's a healthy score, 13%. And then the last one, 4%, also the equal bottom, a research community interface service with the general public, which I think is also interesting, because I think personally, I think that's really important, but it's just really difficult. But so I think that's really quite useful. Thank you very much, all those who voted. Sorry? Oh, sorry, there's one more question. Yes, we'd like to know a bit about you for our files. We'd just like to know what sort of person you are. Yes. Are you a representative of a patient or associate or organization, an ethical or legal expert? Do you have a data management role? Are you a researcher, technical expert, policymaker or funder, project manager or admin or other? You have one vote on this, not three, just one vote, please. Yeah.
They need to tell us what it is to put it in the category.
Steve, if you allow me, a quick looking at this, maybe for the future stakeholder forum, we should look at which ones are underrepresented, also to ensure that people are.
Have a chat with Gary, yeah.
For example, the fact that the service on interfacing with the general public was low is because here we don't have representatives of the general public. We don't have citizens, we don't have patients, which is something that we should take into account for the...
Do we need to... We are members of the general public as well.
Yes, but as researchers, we are interfacing in different ways, I think.
Yeah, yeah, but I think, to be honest, I think this is an area where researchers have to take the lead. But you know, I think it's a problem, yeah. Jack?
No, I just wanted to say about that it's important for the research and policy makers community that the trust of the public is something very central, meaning that I know that there are some countries who are very concerned. For instance, the Scandinavian countries are very concerned about the trust of the public in a, so with regard with the repository. So I think it's important. Yeah. I wanted to make another point related to the 10 services. I think the first one, the which is about the monitoring, is something very important. But I think it could go beyond just monitoring, and it could go also to the establishment of funding recommendation, a bit like the cancer mission, meaning there is a board, and the board make recommendation in terms of funding, and this mentoring activity could have the objective of establishing a link between the EHDS and the EOSC, and could make recommendation on what are the next bricks to be funded to really establish the building, the right architect for this building.
So that's a sort of model that could be followed in this context as well. Yeah. So we've got 36 people who've actually said who they are. So gone one up. So yes, as you'd expect, mostly researchers and project managers, admins, data management role. Thank you very much. Useful data, and something to take forward, and hopefully, as we say, added to in the stakeholder meetings as well. Interesting. Thanks for Mariola as well for doing the Mentimeter. Thank you very much. Any other comments? We're approaching 1 o'clock. I don't want to put any pressure, but any other any other comments?
Yeah, maybe just briefly to reflect on what Christina said about the need for guidelines and recommendations. So if I think about these services, even though they have a particular name related to fair data or related to interoperability, I think underlying that service is the need for that service to provide exactly that. So even I would say at the meta level that they all provide recommendations of how to interact with EOSC or the European Health Data Space, but the actual service itself would be a toolkit for recommendations or training or something else related to that topic. Yeah. So even though it's slightly differently named, I think there is a lot of alignment with what your plans would be.
Yeah, this is very much the 10,000 feet or the 3,000 meter view, rather than getting into the details of any particular scope, any particular project. Yeah. Okay. Thank you very much.
Thank you.
And the best of luck.
Closing there?
Yep.
Time to close. Time to close today.
So it's time to come to a close. So, and when you organize an event, we have been these 2 very intensive days. I would like to start saying thank you to Cristina and to Mariola and to the people who has made possible this event. Thank you very much. It's been a lot of work outside home,
Exactly.
which is
So this
even more complicated.
yeah, this remote organization plus the hybrid format, so that means huge effort. So we really appreciate the work they have been doing, and we really appreciate your participation here and also your participation at home. And okay, thank you very much to all the speakers here, there. Thank you very much for all the inputs you are giving to us, because to shape this strategic agenda, the roadmap, all the outcomes of this project, and the engagement we want to put in place with the stakeholders involved. All the discussions that have been taking place yesterday and today are crucial to make this project a success. Okay, just give my honest thanks to you again.
So, and just to go a little bit forward, the work that we have shown the last two days has been the work of 18 months. A lot of work, a lot of meeting, a lot of discussion, and we have 6 months ahead. Thank you for removing 2 months for the calendar. So we have 6 months ahead, very interesting, where we like to refine what we have. So we have a starting point that is a draft strategic agenda, and we expect your participation, your active participation, not just from the consortium, but from the many stakeholders that we are going to be talking with, including the Commission.
Yep.
We want your guidance. We want to explore those boundaries, where we shouldn't be considering, where we have an open landscape. Please let us know that place is not for you. So don't tell us where to go, but at least tell us where not to go.
The negative way.
Thank you.
Okay.
But
thank you.
Thank you. Just to mention that, first of all, I said how much we appreciate all the colleagues working in RTD. The HealthyCloud is funded by the Research and Innovation Program. This interaction and the latest developments in this dynamic collaboration with the community that we have. This is really fantastic. And what I wanted to say also, congratulations for the first draft of the strategic agenda, because it is like, you know, it is a pragmatic description of the landscape and of the different challenges, but this is the inherent challenge and complexity of health research. And of course, you would come with this kind of broad aspects, challenges. And we have a lot of opportunities, you know, in the health research infrastructures work program. It's not the health research program where I'm working, but the health infrastructure work program. They are going to come out pre-publications of the proposals and the calls for 2023-24. They are coming out today, actually.
Today? Okay.
Or today or tomorrow, maybe they are already out. So you can see the infrastructure work program has really evolved to support EOSC, all the concepts of EOSC. But the thing is, health research is in between. You know, if you want to do advanced and innovative research, you need to bridge the worlds of health research and the healthcare, and it's always this kind of the dynamic of this interaction. And so there can be opportunities, I think. And if you see also the health research program, there are also a lot of data-intensive, of course, efforts. But as a low-hanging fruit, I think the community keeps asking for some guidelines, actually.
So that's, we're taking note of this.
Yes, sorry for repeating it.
No, we take note of this guidance by your side, and we will do our best, or providing and delivering. So we can close here. Thank you very much for your participation here and online. And happy to see you soon.
See you soon. Safe trip home.